We're rolling into the female reproductive system today, reviewing you the males. Major parts, right? Any questions here before we jump? Yes? Whole diagram. Yes, ma'am. Yes, ma'am.
Can you quickly review the processes of
I don't want to go there. I'd love to have you go back to what I covered. It's on my recording. It's in the textbook. It's straight up. Your textbook lists ejaculation, orgasm, erection in the male. It's straight up right in the textbook. Okay? All right, so we're moving on. This is my least favorite picture. I always think this is just the dumbest picture. Because you can't, it's like, well, what is that even supposed to be? This is a sagittal cut, right? Female body, sagittal cut right down the middle. And again, remember, the books are always trying to walk this line between teaching you the anatomy and being pornographic, right? So that's why they get these stupid views. Even the college textbooks look like this. It's life. You have a college textbook, by the way. That's what you have there. Main pieces. We'll talk similarities between the guys and girls first. You see, of course, the rectum, anus, large intestine, right? That's over here on the right side. No different than the guys. You see the bladder. There is no tubes going around it. There is no vas deferens, right, going around the bladder like there is in the male. You simply have the urethra. Thank you. You simply have the urethra that comes straight out from... Did I pick black? Sorry, I really need you to stop talking. I appreciate it. If you need to whisper some comments, I'm fine. Okay, thank you. You do have the urethra coming out here, right? But of course, you have another opening. And that's where the significant difference comes between the guys and the girls. Whereas the males, the urethra is the combined exit, right? You get the urine coming from the bladder, you get the semen coming from the testes and the prostate gland and the seminal vesicle and the bulbourethral gland, all coming out one opening. You have two separate openings for the ladies, right? A little organ on the front here called the clitoris. We'll talk more about that. The labia minus and labia majus, or minor and major, you could call it that as well. Does anyone know what labia means? It's Latin. I thought I heard somebody. Lips. Yeah, that's what it is. So it's this external and internal covering, major being larger than minor, right? What's the point? What are the point of those flaps? Protection, right. You're trying to, because again, this is an opening that's permanently open into the body, right? So you're trying to provide some covering, trying to provide some protection there, right? Symphysis pubis, you remember this, right? That's where the two hip bones come together, right? The two pubic bones. Remember the three parts of the hips: iliums, ischiums, pubic bones, right? Where they come together, that's the pubic symphysis. Okay? The other piece that's mentioned here, at the end of the vagina, you have the cervix. Again, we're going to talk much more about all these pieces. I'm just showing it to you on this diagram. Then the cervix is the opening into the uterus, which normally a pretty small organ, not a whole lot to it. Those of you on your cats that were not pregnant, you saw it was a pretty small something. There wasn't much there. Those of you who had the pregnant cats, significantly larger, right? And that's the same thing that happens to us humans as well. The other piece you have is the uterine tube, or the fallopian tube. That's right here. The ovary is this piece here. And the fimbriae are little fingers that kind of guide the egg into that uterine tube. We're going to talk tons more about all of this stuff. But I just want you to see it here on this picture. And again, this is one of those diagrams that I do want you to know. Okay?
What is that mass by the
This?
no to the left? Yeah, no left. That like it's not labeled at all.
I don't know where.
It's where the uterine tube, like the whole space.
Just all this? Oh no, that's just the abdomen. Just the abdomen, yeah. So the other intestines, your small intestine, large intestine would be in that area. Yeah. All right. So external view. This is what it looks like externally. Okay? This is not. No, some of these are not in the book. It is up on Schoology for you, though. Okay? And again, here is where, from the guy's perspective, we only have the one opening. For the lady's perspective, you do have two. And again, I'm speaking two, and then, of course, the anus. So small little urethral opening, and then the vagina. And the clitoris being up on top. You see the labias, right? The majora, the large, the major on the outside, and then the minor on the inside. Mons pubis, that's basically, mons means mountain. So it's just this little hill, the roundedness. Basically, it's this this little, I guess fat is the word I want. Basically where the pubic symphysis is. It's just a little mound, little hill there. Questions here? No. These diagrams are not in your textbook. So no, I do want you to know this one, and then the one that's going to be over on 519, I think it is, which we'll get to shortly. You may have wondered, well, Mr. Hess, do you remember the guys had other glands too, right? So we had the seminal vesicle, we had the prostate, we had the bulbourethral glands. Are you with me, friends? Remember these things? Do the ladies have the same thing? They do. So, just so you can orientate yourself, clitoris on top. So we're looking, this is superior on top here, inferior here. So clitoris, vagina, right? You with me? The urethra in the middle. And you have these little pieces. Stay with me, guys. You have a Skene's gland, and you have the Bartholin's gland. So the Skene's gland is basically the female prostate gland. There are, now remind me again, what does the prostate do? What's its function? Produces, no, that's a seminal vesicle. It's good, the fructose. It's the alkaline fluid, right? The white milky fluid, right? To balance the pH. So the Skene's gland can produce a fluid that is what is ejaculated during female ejaculation. Now, there is not always a significant amount of fluid. Some ladies don't have this at all. Some do. Some produce a tiny little amount of fluid, like less than a milliliter. Some produce up to a couple of milliliters of that ejaculation piece. So that is what would be caused that. The same with the Bartholin's gland is the same as the bulbourethral gland. Remember that was a little bit of lubrication that was produced. So these guys help with lubrication of the outside. So this would be lubrication of basically the labia minor, this outside area. The vagina produces its own lubrication, which we'll talk about that. But lubricating the outside of that area. So ejaculation, maybe you've heard this term squirting before. Oftentimes that's urine. Okay, there can be a urine-like substance that is released. But again, it does not happen significantly. Statistics are anywhere from like 3% of women up to 20, 30%. It just depends on what source you're looking at and how you define it. Okay? But yeah, it's not, it doesn't happen all the time by any means. And truthfully, if there is some sort of ejaculation from the female, often it's not noticeable. Like it's not enough to even cause any. But if it is, know that that's why. That's the cause. It's not a problem. It's not a difficulty. It's just it's there. It's part of what happens for some folks. Okay? Questions there? I truthfully didn't even know about these glands until I started teaching this class. Someone asked, do women have these same pieces? And I said, I don't know. And sure enough, they do. What's that? Oh, yes, it's coming. It's coming. The covering, so if you go back to this opening here, to the vagina, there is a layer of tissue that's often present on the outside that's called the hymen. You all heard this term before? So back in the day, let's say a couple hundred years ago, certainly, you wanted to marry a virgin, right? As a man, you wanted to make sure your woman was a virgin who you are marrying, right? Because otherwise, she's a terrible person, right? Again, from their perspective, okay? So they would expect the first time that they had intercourse, there would be blood on the sheets. Because though it's a very thin covering, it would tear during intercourse the first time, right? Which would then cause little bits of blood, and okay, that's how we know that you're a virgin, right? Truthfully. No, like literally they would look at the sheets, they would look for this, and they would take it out. Oh no, look, yes, she's a virgin, yes, see, as a father, I am vindicated, my daughter was a virgin, see? But in actuality, the hymen is so varied that you can't use it as a predictor for whether someone has had intercourse or not. Okay? This is a picture of just the various different types of hymens that could be present. Okay? Oftentimes, it is torn simply through physical activity. If you played sports, if you rode a horse, many times that has already been torn. It doesn't mean that you had sex or you did something wrong. It just was. Some people aren't even born with it. They're already born with that hymen open, with the vagina fully open. Right? Using a tampon, because of course you're inserting the tampon into the vagina to catch the flow of the menstrual blood, that can do that as well. The point I want to make sure you hear, because one of the questions folks asked was, is there a way to tell if someone is a virgin or not? There isn't. There isn't. Well, of course, you would talk about this, I hope. Certainly. But I'm saying there is no physical sign. Does that make sense, friends? Okay. Thankfully, we've moved past that, but that is certainly something that folks worry about. Have I done something that makes me not a virgin? No, if you haven't had sex yet, you are still a virgin. We'll talk about, one of the questions you all asked was, how would you define sex? In this case, we're talking about intercourse. We're talking about penis into vagina. Okay? This is another great slide. And again, neither of these are in your textbook. Shh. This is from... Stay with me. This is from, it's a book called Netter's. Netter's a Human Anatomy Atlas. We called this the Bible, in my PT program. Like you were using this book all the time. It's a big, thick picture textbook. And what this is showing you is, this is what we all start off with. These undifferentiated external genitalia. And then from there, you differentiate. And they're showing you what tissues become what. Does that make sense? So what is the head, the glands of the penis, becomes the prepuce of, or the glands of the clitoris. Right? What becomes the scrotum in the male becomes the labia majorum on the female. What was the testes inside there become the ovaries. Are you with me? You can see the opening, this urethral fold, that in the male closes totally, in the female stays open as these labia to let the opening of the urethra be present there. Does that make sense? I thought that was just it's a great visual to see. Oh yeah, Do you understand also now why there can be difficulties or problems with that differentiation? What if they don't differentiate totally, right? What if you get a little bit of both? What if that opening doesn't close all the way? So these would be where you have the whole spectrum of what you would call transgender folks, who are a little bit of both. Or maybe not simply, I'm not talking about just preference or orientation, I'm talking about physical body, like the parts, right? Because for the most part, how do we name you female or male? Well, when you're born, the doctor looks, oh, yep, it's a girl. Oh, yep, it's a boy. Well, what if it's not so easy to tell? You know? What do you do then? Whole bunches of other issues to deal with. Questions there? No questions? We're good? All right. This is a picture that you do need to know. This is over here on page 519 in your textbook. So this is an anterior view. Okay? So the other one was a sagittal slice. This is an anterior view looking just at mostly the uterus and the ovaries. So down here in the bottom, this is the vagina. Length, I don't know the exact length. What's your average length of the vagina? Large enough to fit the average penis. I don't really know, to be honest. 5 inches maybe? And it's very, what's very cool about the vagina is it's very elastic, okay? And the point of that being, well, for sexual intercourse, number one, but what's its main goal, its main purpose? To birth a child, right? And realize that baby grows in the uterus and then has to exit through the vagina. So you need a pretty stretchy, a pretty expandable exit, right? And we'll talk way more about that in the future. The cervix, have you heard this term before? The cervix?
Yeah.
Childbirth, cervical cancer, that's a very common form of cancer in women. That's what you get a pap smear, is testing for that. The cervix looks like this. This is a much better picture of what it looks like. So this would be if you were having a camera inside the vagina looking up at the cervix, this is what it looks like this little donut shaped. That's a nice healthy one. If you see these growths that are on there, that would be cancer. That's showing you cervical cancer, a carcinoma. Okay? And a pap smear is literally taking a little bit of this tissue and culturing it to make sure there's no no cancer that's being formed there. In childbirth, this is when they talk about this being dilated. This cervix opens up to literally about 3 inches around. So that, why? The baby's head can come out. Right, exactly. And once you reach this certain dilation, that's when the doctor knows, okay, yes, we're ready to start this birthing process. The contractions are stretching that open. That's the whole point of that, is to stretch open that cervix. Okay, and again, that's basically the opening, the very bottom part of the uterus. Okay? You see that you've got these 2 uterine tubes that are coming from here, right? A fallopian tube, that's another old word that's used for those guys. And you can see that this here on the end, those are the ovaries. And again, you have 2. Ladies, you have 2, right? And they basically alternate. 1 month, this one releases an egg. The next month, this one releases an egg. And they usually just bounce back and forth. Sometimes if they release 2 eggs, that could be twins, right? Fraternal twins, not identical. Because it's basically 2 eggs that get fertilized. Are you with me? They can be 1 from each side, could be 2 that release from one side. It just depends. Identical twins would be after they are already fertilized. After the sperm and the egg meet, then they separate. Yeah. That is a great question. I'm pretty sure fraternal is more common, but I don't know for sure. I don't know for sure. Okay. Can you see better now? These little things they call fimbriae. They're like little fingers on the end of those uterine tubes. And like what those do literally is when the egg is released, because the egg is released outside this tube. You see it, right, on this picture? Here's the egg, right, the oocyte. It literally like draws them in. Come, come. You've been released. Come into the warmth of the uterine tube. And it draws it in. Now die. No. And this large kind of funnel, that's the infundibulum. The funneling that egg into the uterine tube. Have you heard of something called an ectopic pregnancy? Ever heard that term before? Sure. So the egg's supposed to get fertilized here and then make its way down and implant into the uterus. But sometimes it gets fertilized and implants into the uterine tube and starts to grow, and that's a problem. You can die from that. So they would have to go in and remove that.
Do those expand the same way?
No. That's why there's a problem. Yeah.
What happens to the embryo?
It would die. It would be aborted. Yeah. Okay.
So when you
Shh. Yep.
if you were, because you would have to like abort that.
You would.
To die. So how would they get it if it was farther back into the tubes? How would it just be like a drug they administer?
I don't know how they would do that. If it would be a surgical intervention or if they can do it through drugs. I don't know. It's a good question. It's a good question. Because usually the drugs, a drug-based abortion, thank you, would basically mimic your regular monthly cycle and basically shed the lining inside this. Because that's all your period is. We'll talk, well, let's go there. No, truthfully. This period, give me 1 second. Your period is basically, this is, by the way, is showing the lining of the endometrium. This bottom part here, the endometrium. You see the endometrium here? That inside, come on now. The inside layer of the uterus. So what your period is simply that endometrium building up. It's building up, building up, building up, building up, building up, building up all 28 days here. Why? Well, because if you get pregnant, if your egg gets fertilized, it needs to have this nice built-up layer for it to implant the new egg, right? The egg and the sperm together, to implant and to begin to grow as a baby, right? If you don't get pregnant, then after those 28 days, it literally sheds that layer, that skin inside. You notice all the blood vessels, right? All the blue blood vessels, so you bleed. You get back to what you would call the beginning, the normal state of the endometrium, and then you start the cycle again. Does that make sense? So that's what the blood flow is. Your question?
Sometimes girls feel like they're ovulating.
Yes.
What is that? Like, is it the fingers?
You're saying like you feel a certain pain or you feel some pressure or?
Yeah, like what is that?
They like take turns ovulating as well.
Yeah, I mean, there is, I am not aware of any sort of nerve endings that would be here that would provide you a sensation of actually feeling it. I think what you're feeling is the change in the hormones that produce that, but I truthfully don't know. Again, I'm not aware of, that's not really an area where you would expect to be aware of those kind of sensations. Be more like a referred pain kind of thing. But I don't know. It's a good question. Yeah, but again, I've certainly heard that. Piece. Yes.
I don't know what this is, but what's the role of the
cramping during your period. So that during the actual flowing part, it's kind of the uterus trying to expel the stuff that's in it, right? Because again, basically that whole inside layer all comes off. Beforehand, like PMS kind of stuff, that's more the hormones. Yeah, and it can be back cramps. It can be, you all know, there's a wide variety of those kind of things. There's a wide variety. It's a wide variety. And different women have different ways of responding to it. My wife, for her, for Rebecca being born, like her labor was very much a back labor. Like she was like, it felt like my back was just tightening. It wasn't the same kind of, so even between two kids, it was different, how she felt, the manifestations of the same process happening. In a tiny, tiny scale, yes. A much less scale. But yeah, same organs involved, similar hormones are involved, yeah. Yeah.
Aren't your cramps considered like mini contractions?
A little bit, yes. Because again, the point is they're trying, it's your uterus kind of cramping to expel the stuff out. Yeah.
Like, people know that. Like, they can get it. That's the thing. I'm so terrified.
Good. I'm encouraging you, ladies. Thousands of years, folks have been able to do this. You'll make it. You'll make it. If not, epidurals, right? Epidural is simply they put a needle in, and it gives you some numbing, like it takes away pain. You have to be careful they don't put it too high. My wife, for Alex, it was a little too high, so she was like basically numb from the waist down. So it was a little hard to push. So she worked a while at that. But pain-wise, no significant pain. No. There's always any sort of medical intervention. There's always some risks, but no, I wouldn't say the vast majority. I am almost certain, because I'm going to hedge myself a little bit here. I want to say something on the order of probably 65-70% of American babies who are born, mothers have epidurals. It's very common. It's not a significant risk factor. No.
Yeah, they're like, no, you out.
Who is this?
Like, if you're getting anesthesia to deliver a kid,
Right?
like every person who's gone through labor that I know in the hospital, they're like, almost try to convince them out of it, like they freak them out.
I am not one. I could have outdated information, not that I'm aware of. I think that's a very, like the American College of Gynecology and Obstetrics. It's a very accepted practice. Not encouraged, because it's very much the woman's decision as far as what she wants. But no, it's not like some outlier or some strange thing. Some women are very manly about their childbirth. Oh, I didn't have any drugs at all. I want a natural. And I mean, I say this in jest, but like it's a point of pride. Hey, I did this. Cool. Whatever floats your boat.
Do you want to put,
Just saying. But again, for some people, it's very important. They find they don't want anything artificial. They don't want anything non-natural.
I have a question.
Yes.
Shh. Like when women spend a lot of time around each other, like they get sick?
They do.
What's the science behind it?
It's about the hormones. It really is. They do. They do, truthfully. Yeah. How? I can't remember the name of what it's called. What is the pheromones? It's basically hormones that are being produced externally. How does a guy know that a girl is interested in? It's pheromones, right? Yeah, right. Very much is. Yeah. All right, I'm going to stop this recording. We'll keep going here, but I'm going to stop this here.